Good evening, my brothers and sisters. One of the best things in life is your health. Whatever thing that we are doing, our health is very, very important. I want you to take notice on this health ethics, mostly for men. Listen to it.
A question that interests many people is, how often should a man ejaculate each month to potentially reduce his risk of prostate cancer? According to a widely cited study, the answer may surprise many. Nearly 32,000 men participated in this research, providing detailed information about their ejaculation frequency. Based on these data, researchers from Harvard University examined whether there was a connection between ejaculation frequency and the risk of developing prostate cancer. The goal of the study was to determine whether there might be an optimal number of ejaculations per month that could contribute to prostate health. The findings showed that men who ejaculated around 21 times or more per month had approximately a 30% lower risk of prostate cancer, nearly one-third less compared with men who ejaculated less frequently. This result is considered remarkable, as prostate cancer is among the most common forms of cancer in men, particularly with increasing age. Why might ejaculation provide such a benefit? Researchers hypothesize that ejaculation may function as a natural cleansing mechanism for the body. Since the prostate produces part of the seminal fluid, regular ejaculation could help flush out accumulated substances or potentially harmful compounds from the prostate. Although the precise biological mechanisms are still being studied, the flushing theory remains a plausible explanation for the observed association. Interestingly, this potential benefit does not necessarily have to result from sexual intercourse with a partner. Before anyone jokingly claims that a girlfriend, wife, or partner could save him from prostate cancer, it is worth noting that the study did not distinguish between different forms of ejaculation. Masturbation also results in ejaculation physiologically and, according to the interpretation of this research, may have a similar effect on prostate health. In other words, what appears to matter is the overall frequency of ejaculation rather than the specific way it occurs. The commonly cited figure is about 21 ejaculations per month, which averages roughly 5 times per week or nearly every other day. The original presentation of these findings also ended with a humorous remark. Fortunately, no teenagers aged 14 to 16 were included in the study because, as the joke goes, many of them would probably have reached the 21 ejaculation mark before the end of the first week. Nevertheless, an important clarification is necessary. This was an observational study. That means it identified an association between ejaculation frequency and a lower risk of prostate cancer, but did not conclusively prove that frequent ejaculation is the direct cause of this protective effect. Prostate health is influenced by many additional factors, including age, genetic predisposition, diet, lifestyle, and regular medical screenings.